My name is Hans-Peter Weber. They call me HP. I grew up in the area of St. Gallen and then went to dental school in Bern, graduated in 1976, joined the Department of Removable Prosthodontics under Al Gehring, who is an ITI fellow also, and worked under him for 4 or 5 years. Went then into periodontics and fixed prosthodontics under Klaus Lang, and learned the trade of treating periodontal disease combined with fixed prosthodontic reconstructions. At that time, also decided to stay in academics, which required that I was going abroad for a year. 87, I moved to San Antonio as a visiting assistant professor and worked in the periodontal department there. Which made my entry to the US. I decided to stay in the United States, moved to Boston, 88, and that's where I have been. I'm currently the professor and chair of prosthodontics and operative dentistry at the Tufts University School of Dental Medicine, and very connected with the ITI since the mid-80s. My expertise, as I mentioned, started with removable prosthodontics and then periodontics and fixed prosthodontics, both at the time when we did not do dental implants yet in our graduate or postgraduate education. We started in the mid-80s planning and placing implants in collaboration with our former ITI president, Daniel Buser, who is the chair of oral surgery, then, of course, also junior faculty like myself. We closely worked together and planned patients for implant prosthodontic treatment. Implants were placed in oral surgery, and we restored them then with our students. My full-time appointment and position is at Tufts University School of Dental Medicine in Boston, Massachusetts. I'm 4 days at the school, and 1 day I am allowed to work in private practice. And I do this in downtown Boston in prosthodontic specialty practice. It was obviously, again, coming from both the prosthodontic side and the periodontal or periodontic side, looking at patients who lost all the teeth, especially in removable prosthodontics, and had a hard time functioning with their dentures because of advanced ridge resorption. On the other side, in periodontics, patients who lost teeth that could not be saved because of their disease, being able to use implants to replace those missing teeth or to support dentures was obviously an option we did not have at all before and struggled often, especially with removable prosthodontics, treating those patients as effectively and satisfactorily. So the implant alternative obviously brought a great addition, and with that came the fascination in terms of research and teaching and patient care in this subject.